Welcome to Facts TV News, where everything is true. Flankers Health Center opening.
However, we would be even happier if residents would do all they can do to take care of themselves, of their personal health and safety, so that they will not need to visit the facilities very often, because the best health center is the health center that don't need to be used.
If you look at the facility behind me that we will be opening shortly, you can see that the residents of Flanker will receive state-of-the-art health care, not only by the facility that they will be in, but by the continued workers of the Ministry of Health and Wellness. And so it is for that reason that we come here today under the auspices of the Poverty Reduction Program, a program that has been established in JSIF more than 20 years, a program that has been funded from its inception by the European Union and backstopped by the Planning Institute of Jamaica as a national authorizing agency. And so today we have, as a part of a bigger project, the Flankers Health Center, where we demolished the existing concrete structure. We've added 2 new consultation rooms, 2 treatment rooms, a health inspector's office, administration offices for the nurses, and of course perimeter fencing. And this has come at a cost of approximately $47.3 million. And we take the opportunity to recognize the residents here this afternoon. More than 3,000 residents and 14 members of staff will benefit from this new facility.
The EU remains Jamaica's largest provider of grant resources and continues to be deeply committed to supporting the attainment of Jamaica's national development goals. This commitment is evidenced by the current GOJ-EU cooperation program, which is aligned to the country's priorities. And these priorities are articulated in the successive medium-term socio-economic policy frameworks, or we call our MTFs, utilized to implement the National Development Plan Vision 2030 Jamaica. I wish to express my own gratitude to the EU on behalf of the people of Jamaica for their support and commitment over the past 46 years. The Flanker Health Center is one of 4 community health centers in St. James, which has benefited from a comprehensive expansion program under the PRP. The total cost of this health center is approximately $52,584,000, which will benefit an estimated 3,000 community members. The value of the health center goes beyond a monetary investment. The benefit to each community member must be seen as follows. 1, the health center will focus on people's well-being in and around Flanker and will enable individuals and families to attain a high level of holistic health. It will provide and promote healthy lifestyle choices through education, public awareness campaigns, and community outreach activities. 2, the health center will offer essential primary and preventive care services, which include basic doctor's visits, immunizations, health screenings, dental and health services. And this will aid in reducing the patient load and waiting time at major hospitals. And 3, through the provision of preventive care and assistance to patients to monitor chronic conditions, it will reduce medical costs as well as expensive emergency visits and hospital stays.
It is therefore a delight for me to join you today for the handing over ceremony for the Flanker Health Center. I understand that in addition to Flanker, this center also serves the neighboring communities of Norwood, Ironshore, White House, Providence Heights, and Seaview, a population of over 22,000 residents, with 2 additional consultation rooms, 2 additional treatment rooms, 2 additional nurses administration offices, 1 additional medical storage room, 1 health inspector administration office, 3 additional restrooms, and improved security due to the perimeter fencing. We can all be pleased that the staff at the Flanker Health Center will be able to provide improved health care for residents. We at the European Union are happy for the collaboration with residents, with the Ministry of Health, and with the Jamaica Social Investment Fund that has made today possible this. However, We would be even happier if residents would do all they can do to take care of themselves, of their personal health and safety, so that they will not need to visit the facilities very often, because the best health center is the health center that don't need to be used.
Health service, public health have to play a critical role in transforming our communities. We appreciate the work of the support of the European Union. We have one program we're working with now, and we know there are others. But I just want to assure you that it's the direction of the government. Sometimes even our partners misunderstand. Projects operated in silos don't give you the results you want. Ministries operating in silos don't. So in fact, if I put on the other cap, as I said, man, that I chair what is called the Citizens Business Council, which is a committee of all permanent secretaries, the heads of the critical agencies, including JSF, the Planning Institute, and Hope Heart Dynasty, to ensure that the government's investment is coordinated and we can guarantee the highest value for every dollar we spend, whether on a building or on the people, and that the right people get the benefit from it.
Today, I really, and as always, celebrate when we improve our infrastructure and we make it comfortable for those persons who are critical to the entire community development process. And I describe primary healthcare, as I say, the nurse, the doctor, the center of the universe of community development and community buildup. And you know, Minister Chang has a cliche, if you will, or a theme that he uses in security. I don't know if you know it. What is the police, the security? A force for good, right? Is that what it says? Well, I'm here to tell you that our public health infrastructure at the primary level is a force for good. And we have to keep preserving it and coordinating it. So I say that to say that Minister Chang, MP Chang and I are aligned, and the government of the day is aligned with the need to recognize, celebrate, and promote causes of this kind. And we pay tribute to the staff and the workers who are here every day and who will be here when we are gone. And we say to the community, work with them, preserve the infrastructure, and see them as partners in your own personal development, because that's what they are. And I want to say to the EU and to JSF and to the PIOJ, as we plan, particularly in a post-COVID era, we should always be looking for the gaps and filling those gaps and continue to recognize the importance of our healthcare system and the primary healthcare process. Congrats to the team here on the ground, and congrats to those who will benefit, particularly the community.
Pizza Hut delivers a slice of Christmas joy to children in state care. The residents and staff at 5 children's homes in St. Andrew, St. Catherine, Clarendon, Trelawney, and St. James kicked off their holiday celebrations last week with specially catered meals and gifts from Pizza Hut Jamaica. More than 160 children at the St. Augustine Place of Safety, Blossom Gardens Child Care Facility, Granville Place of Safety, and Nest Children's Home benefited from the series of festive holiday treats. Christmas is a time for spreading love and joy, and each year we do that by sharing the gift of delicious pizza along with the hopes of bringing a smile to the faces of young ones, declared Pizza Hut Marketing Officer Levine Sharif. Even though our interactions are still limited as a result of the pandemic, just the idea that we can make their day just a bit brighter is enough to warm our hearts, she added. Khadija Shaw, at heart of the Wicked Girls transformation. In 2019, Jamaica showed that World Cups are about more than just wins and losses. The Wicked Girls may have lost all 3 of their group stage matches, conceded 12 goals and scored just 1, but being there was transformative for a country that waved the flag for the Caribbean as the first from the region to qualify. At the heart of that transformation for the nation's female footballer is Khadija Bonishaw. She has yet to celebrate her 25th birthday, which will come on the 31st of January next year, and she is already her nation's all-time top goal scorer. Most of us were in college, Shaw says, speaking from Manchester City's training ground. We didn't know what we were getting ourselves into. We just had that dream of qualifying for the World Cup one day and knowing how many times it would change back to Jamaica. Shaw says the key takeaway from France was understanding from everyone involved of the importance of building chemistry and being together as a group. The team had few opportunities to gather from camps in the past and would only be able to come together for tournaments and qualifiers. A camp was held recently in Miami, so there are encouraging signs of improvement in that department. After the World Cup, we sat down and spoke with the Federation and gave our points about what we took from the experience, said Shaw. It's definitely improving, and I know that it takes time. As a team, we know that. It's just a matter of seeing the progress. As patient as we are as well, it comes down to communication and trust in the long run. Jamaica had the youngest squad in the World Cup in 2019. We are all young, with the experience and having camps and the building of chemistry within the team. We are definitely continuing to improve, said Shaw. There is an abundance of young talent coming through. Jodie Brown, for example, was just 17 years old at France 2019 and recently played a pivotal role in further stage run to the College National Championship. Jamaica's road back to World Cup will begin in February and April of next year when they face CONCACAF Women's Championship qualifier against Bermuda, Grenada, Cayman Islands and the Dominican Republic. The 6 group winners will join Canada and the United States in the CONCACAF Women's Championship in July 2022, where the top 2 teams in each group will qualify for the World Cup and the third-place team will advance to the Interconfederation playoffs. We're not going to take any team lightly because the ball is round, said Shaw. Once you cross that white line, everyone's equal. Shaw's success with the Reggae Girls led to a move abroad to France in 2019 after hugely successful college spells in the United States with the University of Tennessee, where she made the switch from midfield to the forward line. After scoring goals for fun, it was time to put her game to the toughest test, and she signed with FA Women's Super League side Manchester City in June 2021. I was at a smaller club, so right now obviously I'm adjusting to new coaching, new playing, the club, the players. That's one of the biggest things for me. To be patient with myself and trust my instincts and what I'm good at and just continue to focus on that. In terms of the team, it's an incredible group of players that push you day in and day out, so I definitely think that I'm getting tested throughout training for sure, she said. It can easily be forgotten just how monumental it is for Shaw to be playing in one of the strongest and most visible leagues in world football. Bonnie is unquestionably a huge source of inspiration and a beacon of hope for young footballers across Jamaica and the Caribbean. I was once in their shoes, so I know what it feels like looking up to someone like, for example, Raheem Sterling. It means a lot to me, and it helps me also. Some days when I don't feel like I can give or go that extra mile, I just think about all the other players back home. It helps me get out of bed sometimes in the morning to go out and work hard. For me to be here at Manchester City, that alone speaks for itself. I'm enjoying it, and I'm just going to continue to improve, she told FIFA.com. And all the signs are there that the Reggae Girls will too. Please remember to subscribe, like, share, and click the notification bell for daily updates.